First, I want to welcome everybody to this morning's seminar and acknowledge that we're on the lands of the Yagara and Turrbal peoples here in, a bit rainy southeast Queensland this morning, but we need the rain, so it's all good. And just to acknowledge the elders past, present and future of the lands where we are here, but also like to acknowledge all the lands of the First Nations peoples from wherever people are this morning. And also I'd just like to acknowledge any of our Indigenous colleagues that are with us this morning, and particularly acknowledge Rachel and thank her for her time and expertise this morning. So Rachel is from the Yuin Nation. Rachel, have I got that right? Yep. It's on the south coast of
New South Wales.
Yep, beautiful part of the world down there. And not Rachel, Sarah is Sarah Farnback. Sorry, so Rachel Wallace. What else can I tell you about Rachel? She's got a current appointment, I think, with NADA, Rach.
Yep.
And NADA's a New South Wales Agency Alcohol Services Network, something like that. A network of NGO drug and alcohol services in New South Wales. There's CUNADA up here, so there's various branches of those networks across Australia. Rach has worked for years, I think she just told me 19 years now in drug and alcohol. So she's been working in the space for a long time. And, you know, from a personal point of view, Rachel's always been really generous with her time and expertise with me. She lets me make lots of mistakes and say stupid things and still is happy to work with me. So, you know, personally, I've really appreciated the opportunity to work with Rach over a number of years. Sarah is at the National Drug and Alcohol Research Centre, which is part of NSW in Sydney. Sarah and I, before I left NDARC, Sarah and I worked together for a long time over quite a number of different projects, and we both had a really shared interest in trying to improve drug and alcohol outcomes for Indigenous people. So I might leave it at that. Feel free, Sarah or Rach, to say anything else that you'd like to about your kind of background, and otherwise I'll hand over to you.
Thank you, Anthony, for that introduction. So, yeah, I might start by I'd like to acknowledge the traditional owners of the various lands that we're all meeting on today. I'd like to pay my respects to the elders past and present. I'm currently on the lands of the Wadi people of the Darwin language speaking group. I'd like to extend my acknowledgement to all the First Nations people who are joining here today, and also extend my acknowledgement to your elders and country. And I'd like to acknowledge everyone who's joining us today. So just a bit of background about the project. So we know alcohol, risky and harmful alcohol and other drug use has harms to individuals, their families, their communities, and this AOD use is linked with health and social issues. So we know drug and alcohol services delivered through government organisations, non-government organisations, and our Aboriginal community controlled health organisations, which I will call ARCHOs from here on in. So yeah, I work for NADA. So NADA is the peak body for NGO AOD service in New South Wales. We have over 80 members, 18 ARCHO members, and still trying to recruit more. But our current data is showing that 25% of our episodes of care to all of our NADA member services, episodes of people who identify as First Nations people. So that's a high number. That's 1 in 4 people accessing our services. So this is the reason why we need to do this project. We know we know that some of our health services have low levels of cultural competences, and so then less likely of First Nations people accessing that service or coming back to that service. There's regular reports of racism in our health system. That's just known. So this project was a need to support mainstream services to improve their practices with working with First Nations people. But it's really important to note that this work does not replace the work of our our ARCHO services. Our AMSs and ARCHOs are the best placed to provide these services to our communities, but there's times that First Nations people may choose to go to another service and not go to the ARCHO service. And so this is why this is important, that all our services are culturally competent in working with our mob. So what we did in this project, the first thing we developed a First Nation Projects Advisory Group that overseen this project, and it was made up of senior First Nations AOD workers. So in the beginning, we done extensive consultations across New South Wales. So I travelled around New South Wales. I spoke with First Nations service users, First Nations AOD workers, community groups. I spoke with elders groups. Then we started to look at the literature that what was out there already, because we didn't want to reinvent the wheel, and we know there is a lot of literature out there. So from the consultations and what we heard from everyone I spoke to, and also what we found in the literature, we developed a guideline. We developed an implementation workshop, and we developed an audit tools, which Sarah will speak more about. So this project was delivered across New South Wales, over 6 PHN regions. 15 services put their hand up to participate in this project. That was all voluntary. Yeah, they joined onto the project. So this is the guideline. So you can find this on the NADA website, and it's based around 3 core principles of choice, which I spoke a little bit about: respect and person-centered care. So the themes, the guidelines. So from the literature reviews, from the consultations, these are the themes we come up with in the guideline and what we developed. So the first one, creating a welcoming environment. And, this is the first point of call for a First Nation person who comes to your service. So this is how a person is treated. This is how welcoming the environment is. And when I talk about the environment, if you do have artwork up on your walls, that it's local artwork, there's not tokenistic, but, also having stuff in, your waiting room of NAIDOC week, and having local art show brochures. And I think that's really important that they're displayed. Service delivery. So this is around supporting a service to have flexible service delivery to for their service for working with First Nations people. So meeting them where the person feels most comfortable. And also, it's because I've managed a drug and alcohol service for many years, and it's around the service response time when a person comes into a service. Because sometimes when a person comes into it, from my experience of managing this drug and alcohol service, when they come in and they're looking for help, and if you can't respond quickly, sometimes we lose them, in that time frame. So, taking down their number and not calling them back for a couple of weeks, they could have moved on and they've changed their mind. Voice of the community. Now, this is really important. So this is around having relationships in the community. You want to work more effectively in our communities. It's having relationships in our communities. Community vouching is, real in our community. So, if a service is providing good service, this gets around our community. If service providing a bad service, that also gets around. So, developing relationships, this is, getting out in the community, attending community events. I also, in this one, I've also, spoke to services about it's important where you provide your service, and also where you hold your groups, because if you're doing this in a building or a place in the community that's got bad history for us, for our mob, they won't show up. but most importantly, you got to keep showing up. So once you start to develop these relationships, don't think you've built that relationship and, you know, you've got relationships. You got to keep showing up. So engagement with Aboriginal workers and services. So this takes time. So, you know, you can attend First Nations AOD interagencies. You can, you know, go down to our art show services, have shared working relationships. Some of our AMSs don't have all the AO services, you know, available in their services. So I spoke to services about you may shared working relationships. So having in reach to our art show services, and, you know, so our mob have access to these other services that we may not be able to provide at our AMSs. Capable staff. So this is around the organisation ensuring that their staff are capable of working with our mob. So, and how to support their staff with working with our mob. So, you know, ensuring they got in the correct clinical supervision, their training, just putting support needs around and having those conversations with staff. Yeah, support your staff to working better with our mob. Organisation responsibilities. Now, this is the big theme of our guideline. So this is around recruiting and retention of First Nations AOD workers and how you support your AOD worker, because we need First Nations AOD worker working across the board. So in our art shows, in our NGOs, also in our government services. There's also a part in this theme around the training you provide to all your staff with working with First Nations people. Do you have First Nations people on your board? And like, do you have a RAP? And if you do, is it implemented? Is it monitored? It's not that, you know, pretty RAP sitting on your shelf. Also around having policies and procedures and not having us in your called policy and procedures, which was one. So I've found in one service. So this is where we traveled. So 15 services across the state. So some of these services outreach. So one of them in Dubbo, I think, outreach to all, you know, out western New South Wales. Yeah, so 15 services across New South Wales. And these are the type of services that we tend, so they was all different types. So when working with them, they all kind of had different needs. So when working with them in the implementation workshop, some things were more important for some services that they wanted to make change in. So you can see there the types of services that worked with us in this project. And I'm going to hand it over to Sarah. Thank you, Sarah.
Thanks, Rach. Is that audio okay? Everyone hearing me okay? Excellent, great. So I'd also like to acknowledge and pay my respect to the elders. I'm joining from Ngunnawal and Ngambri lands today, and it's a beautiful rainy day here as well. And I'm sure it's about 10 degrees cooler than where you are. Okay, so from NSW, we were invited to take part in evaluating this project. So we set up with the project team, so that was Rachel and her team, 3 key areas that we wanted to explore with the evaluation. So the first thing was around what we called fidelity. So we wanted to see, was the project completed in full in each of the sites that took part. Next, we wanted to look at the level of acceptability. As this project was working mostly with staff of services, we were focused on the acceptability to staff, but I think we'll come to it in a minute. But one of the big caveats of this project is that we was beyond our scope to really engage with service users, and that would be the next step that we'd like to tackle. So we did look at acceptability to staff. And finally, we were looking at impact. So we wanted to see, did the project change the extent of cultural competence practices within the services? And did it actually then go on to change service use? So did more people attend, and did they attend and complete services at a higher level than they did prior to the project? So it's kind of an ambitious evaluation plan, but we used a couple of different data sources to analyse it. Really, it was 3. Initially, we did interviews, so qualitative interviews with staff and managers of the participating services. We then did a range of audits, which I'll talk to in a moment. And finally, we looked at using the drug and alcohol minimum data set. So the minimum data set is a national set of data that's collected consistently across all drug and alcohol services in Australia, or hopefully. But the idea is that they collect data on the same data points for every person entering and leaving a service. So we use that to determine service use. We also did a survey at the end of the implementation process. So just to try and give you a sketch out of what we actually did. So Rachel's just described how she developed the guideline through consultation and looking at the literature. After that was completed, we developed a set of audit tools. So the audit tools' job was to break down each part of the guideline. So this is each part of the 6 themes that Rachel's just told you about into a set of questions that we could take out to services and ask. And the idea was that we could ask questions that were linked back to the guideline, and we could give each service a score based on the guideline that was measuring the extent to which they were implementing the ideas within the guideline. So that process that I've just described was part of an audit process, and we completed that at 3 time points. Initially at baseline, then Rachel and her team went out and worked with each of the services to implement the changes that they wanted to implement within their service to respond to that first audit outcome. Then we went back at 3 months and re-audited, the idea being to see if we could see any changes between the baseline and the second audit. At that point, we realised we needed a lot more auditors, and so we enlisted some more auditors who Rachel then trained. So then there was a bigger team of auditors who then were involved in completing the 3rd audit, which was done at 2 years. So to roll out the project and simultaneously do the evaluation, we used what we call a cluster randomised step wedge evaluation design, called a step wedge because it kind of steps down, as you can see by the coloured jaggedy bits on the screen. So what we had was we had the 15 services. We grouped them into like geographic regions, basically, and then we randomised them to start time, and each of them started at a different start time point, about 1 month apart. So what you can see here is down the left is the clusters. We had 6 clusters which are labelled by letters, which I can't remember why we did that, but anyway, that's what it was. And you can see that each cluster started audit 1, which is the orange boxes, about 1 month apart. And then we did the same process for audit 2, the same process for audit 3. Oh, and sorry, in the middle there is the implementation as well, which happened in that same staggered approach. Okay, so what did we find? So our first question around fidelity of project completion. So what we've got here is the 6 clusters down the edge of the screen, and then we've got each of the steps that each service completed throughout the project. So you can see at baseline, we had 15 services sign up. And as we step from left to right, these were each of the project steps. So you can see we basically lost 1 service at each time point. So 1 service dropped out at each audit, 1 service dropped out and didn't end up completing the implementation workshop. And then 1 service didn't provide, then all the services that completed went on to provide us with permission for us to use their minimum data in the evaluation. So we thought that was pretty good. 11 out of 15 services who started, considering we had bushfires, floods, COVID throughout the process, that we still had that high level of engagement. We were quite happy with that. We think that's probably a bit of Rachel magic, that the services had such a good experience that they wanted to continue on. Okay, so the second aim was around acceptability to staff. So as you can see now, because the project was working so closely with staff and changing their practices and helping them to identify changes that they wanted to make and implement them into practice, that's why we really focused this initial part of the project on staff acceptability. You can see here in the speech bubbles some quotes you can read, so I won't read them out to you, but overall staff reported that the project did change their practices. There was a lot of interest from staff around implementing changes to improve the way that they were working with their Aboriginal clients and their families. Staff also told us that they really built their skills. They felt that they really learned something around how they could practice better cultural competence. And a lot of these improvements came from the discussions that they had with Rachel and her team. So again, this is the Rachel magic. And those discussions happened sometimes during the actual audits. So when they were sitting there and going through the audit questions, going through the guideline, that was kind of a bit of an aha moment for a lot of staff, who then went on to go straight back to work and then implement something different because they hadn't thought about a particular practice or something that they could do that was quite simple. And so that process of actually doing the audits, and then we developed audit outcome reports that we fed back, was actually seen as being very useful. Okay, we also looked at the acceptability of the workshops. So this was the implementation step that Rachel and her team did with each of the services to sit down and look at what changes they could make. So you can see here, you don't need to be totally across the detail, but broadly speaking, it shows that services thought that the workshops were acceptable, everything went well, they were highly satisfied, and they found the workshops themselves very useful. Okay, so this is where things start to get a bit trickier. So during those implementation workshops, what we asked, rather than trying to get services to implement changes around 21 themes, which is what the guideline ended up being, 21 different action areas, we asked them to pick 3 because we thought that was feasible. They had 3 months to implement something. What were their top 3 priorities that they wanted to work on? So we called these their 3 key action areas. And this is what we measured as our primary outcome, was around to what extent did they change practices between baseline, audit 2 and audit 3 in those 3 key areas. So what we've got here is our 6 clusters, 1 per box. And you can see each line is 1 service and the dot on each line is an audit rating. So you can see at baseline for cluster 1, you can see the audit rating is about 2. By audit 2, it goes up to about 7. And then by audit 3, it was about 9. So overall, we can see between audits 1 and 2, 10 out of the services increased and 2 had no change. Pretty similarly to audits 2 to 3, most of the services increased and by more. A couple had no change and a couple had slight decreases. And we'll come to the why to that in a moment. Okay, so that was looking at the 3 action areas, but we also looked across the whole guideline at all of the action areas that were comprised in the guideline. So when we look at all the guideline action areas, we can see again that from audit 1 to 2, all the services increased. And between audit 2 to 3, again, most of the services increased. 1 had no change and 1 reduced slightly. So we're pretty happy with that. We thought that that really indicated that something had shifted within these services and that it was sustained to that 3rd audit, which was 2 years or nearly 2 years past that first audit timeframe. Okay, so this is the minimum data set. So what we did is we wanted to see if there was any changes in service use that corresponded with the project. It wasn't easy though, because we didn't have much time and we didn't have much money to set up a research system that would sit alongside the project. So we used this minimum data set to see what we could do that was relatively straightforward. We could just get consent from the services to get de-identified data and aggregated data from each service. And we were looking to see what sorts of changes in service use occurred. So we worked with Rachel, with other service providers and with NADA to work out. So if cultural competence shifts, what sorts of changes would we expect to see in service use throughout the project? So our expert group suggested that we would expect to see higher proportions of episodes of care provided to Aboriginal relative to non-Aboriginal clients. We would expect to see more episodes of care, so that would increase. And finally, that we would expect to see a higher proportion of completed episodes of care. So this is people attending a service and then going all the way through to discharge. So on the right here, we've got the results from this MDS data analysis. Each cluster, again, is in a box. Each coloured line is one service. The dashy line from top to bottom is when the implementation occurred, so when the service completed the first audit and that implementation workshop. And what we hope to see was something that kind of went a little bit higher on the right side than the left side. But in fact, what we saw was just kind of a bit of a messy, colourful image. So I've just provided you with one example of the results here. So we didn't see any statistically significant changes in any of these outcomes between baseline audit 1 and audit 2, which is, maybe we can discuss that in a minute. But nonetheless, we thought that that process that we went through really demonstrated that it is feasible for us to use routinely collected minimum data set data in this way to evaluate the impact of different changes or different things that have been put into practice. It was relatively simple because we had a good partnership with NADA. The services were all on board and happy to share the data. So I think just demonstrating that feasibility is really important. As for why we didn't see any changes in the MDS data, I'd be keen to hear your thoughts. We can speculate. It might be that our assumption that changes to cultural competence actually would lead to changes in service use was wrong, and maybe those two things aren't linked. Maybe it's that these changes to practice take more time to actually feed through. As Rachel was talking before about the vouching within the community, perhaps it takes longer for that to feed through to changes in service use. It might be that our outcomes were a bit wonky. As I mentioned before, one of the big limitations of this work was that we didn't have the time to engage with service users. So perhaps if we were to work with service users, we might identify a different set of outcomes that might have changed. And in fact, that would be the next thing that we would really like to do. That was one of the big limitations of this project, was not having that time to do that. So it would be interesting to look and see if there was a different set of outcome measures that we could use that might be linked with changes to cultural competence. And we're sort of speculating here about some of the work that's happened around patient-reported outcome measures and PROMs and PREMs over the last couple of years, which I'm sure you're aware of. Okay, so I'm going to hand back to Rachel, who's now going to talk through the guideline themes with an example of each of the guideline themes of a change that was implemented during the project. Over to you, Rach.
Thank you, Sarah. Yeah, so when I was going out and when I was auditing services wasn't aware that as soon as I walked through that door, I was kind of checking their service out. So their reception area and that. And here's one, the workers realised that, or the service started to, if a First Nations person coming to the service, letting them know that they got First Nations working and giving them that choice. There was one service that I did go out to, and I don't know if it was a result from this service, but they had a First Nations map put up on their wall, and when you walked in, when you're a visitor to the service, that they had pins, and that you put the pin in from the country where you was from, and I thought that was pretty awesome. We theme 2, so we did see services start when I went back out and did the re-audits. They were partnering up with ARCHO services. They were doing joint groups, and we had one service outreaching into an AMS. So putting their services into it was a youth service, putting their youth service into the local AMS. So this one service, I think as soon as I left after the audit, they started putting things into place. But this service went out and developed a relationship with a strong local elders group of aunties, and they end up doing a big community event together, and the team leader was getting, a cultural mentoring from one of the aunties. So that was, they, put that in place from, from this project. So there was a lot of partnerships that were starting to develop. And it was really good that these partnerships, these big organizations going and partnering with the AMS and letting the AMS lead these funding applications up, and just starting to work together. Yes, and so the service that who did started doing the in-reach service to an AMS, their staff started receiving supervision from the manager at the AMS, and how supporting them with working in that community. They were working in, and then theme 6, we had a service that changed their induction and Aboriginal cultural awareness training for their staff. They got rid of the one they were using, but they took on this new one where they actually did a workshop, but the program included, because this service outreach to smaller rural communities, that they would attend a a workshop or an event with the local community about the community. So they were getting to learn about that community. So COVID did hit smack bang in between the 3-month and the 2-year. We had a lot of staff changeover when we went back out for that 2-year audit. One service totally had a whole new team. The Aboriginal engagement worker moved on to another role. They just had a new team. So that team has actually reached out. I did a presentation on this project earlier this year, and because I went back out and did that 2-month audit with the new manager, she's reached out. So she'd like to take her team through this process of doing an audit. I set my notes, see if I'm not forgetting anything. COVID was a big thing, as we know. So, including me, we have 7 First Nations auditors. This project's kind of grown as well. So one of our audits now works for a government department, and was, from her experience of being on the advisory group of this project and being one of the key auditors alongside me, helped kind of change the government audit and how they audit their service, which I thought was a really big outcome. So when we trained up the auditors, and so that the 2-year audit, and had the new auditors going out, conducting the audits, they developed really good relationships. They started to develop really good relationships, and work started coming out from that, because auditors would get to know that service and see what they're doing, and that relationship building was starting just from the auditors and the services. ACTAN's interested. I'll continue to work with ACTAN, because a couple of the auditors on ACTAN, and work alongside them in continuing to deliver this project. I'll hand it back over to Sarah.
Thanks, Rach. That's really our last sort of slide. I mean, we've just got a couple of thoughts here about what we would do next. And, as Rachel's mentioned, there are services that are interested in doing more auditing and more workshops. So that's something that we're looking at. There was a couple of things about rolling out the project that needed to be tightened up a bit. Rachel was very patient with us. She had this big A3 sheets of paper with all the auditing questions and these complicated scoring things. We wonder if there's a better way of doing that, something fancy online maybe. Looking at different ways to improve that auditing process. And then finally, as I've mentioned before, we'd really like to look at those outcome measures using the routinely collected data to see if there are better measures that we could use that more accurately represent changes, or if we need to measure them over a longer time frame, so that would be something that we'd need to do with a strong advisory group and including service users in the next phase.
And also using services users in the next, if we were going to continue this project, actually interviewing service users, because we're going in, we're talking to services, and I think we'll get, that we will learn more from talking to people, First Nations people who access them services. Sorry, Sarah.
Yep.
Just want to jump in with that one.
No, perfect. Yep. And that's a wrap from us. Thanks.
No tricky questions, no.
Right, fantastic. Thank you, Sarah and Rachel. And I'll just open up the floor if anyone's got questions.
Can I just ask a question? So with each of the services, you said that they focused on 3 key areas. Is that right? From those themes. So I just wonder, in the future, if there's sort of scope to look at those outcome measures more kind of closely linked to each of those themes. So say, for example, I think theme 4 was around partnerships, and you might see a change in that in terms of clients that are being referred maybe to other kinds of services. That's where you might see that kind of change in that, rather than like a change in actual things like, care episodes and things like that. And the other thing I wondered is that you had a range of different services as well. Like there were like, what were there? There was like outreach services, rehab services. So I wonder, were you able to kind of look at changes within each of those kind of clusters of services that might have been kind of different? Does that make sense? So, yeah.
They are great. Both really good questions. In short, yeah, I think there is scope to look at the themes. We did have a very quick look when we were doing analysis initially around the different themes that the services selected, but I think there probably is a piece of work in coming back to look at if different themes had different types of changes. We didn't quite get to that, but the data's there, so there's potential to do that. I think that's a really great question. Thank you for reminding me about that. I remember us all saying, wouldn't that be a good thing to do? And in terms of services, yeah, I mean, it's really tricky. As you can see, like the types of care delivered is so varied across these different services. So it is tricky to really get a handle on what that would look like in different services. So yeah, also great point. Rach, anything to add?
No. I think you covered that really good.
Yeah, got it. Yeah.
Thank you for the wonderful presentation. I have a very quick question for clarification. From your audit 1 to audit 2, it's 10 out of 12 services increased. From your audit 2 to 3, 7 out of 11 services increased. What are the measures that the services increased? Because when you measure the proportion and quantity of the episode of care, you said that there was no change, right? But when you present the impact part, the services actually increased. I'm just wondering what were the measures for those that increased?
Sure. Okay, I'll have a go and feel free to jump in, Rachel, Anthony. So I think this is the slide that we're talking about here. So this is using the audits to see compliance, for want of a better word, or the extent to which services are doing actions within the guidelines, so according to the themes. And so I think, if I've understood, this is different to then the service use, which is looking at a totally different data set, looking at service attendance and completions of care. Have I answered that correctly? Have I understood it?
Yeah.
Yeah.
Fundamental part of the program. I've got a question, Rachel, about stigma and maybe for future work around stigma, trying to measure stigma of clients when they're coming to, does it reduce? And is there work to be done around reducing stigma in accessing those kind of services? That's one thing. And then the other part, I feel like, all of us have been delivering cross-cultural training for 3 decades now. And actually, I don't know what difference it's making. And I kind of feel like we've got to continue that. But actually, I feel like it's got to be much more personal. And so really challenging people's positionality. So
I agree.
what is it that you bring? What is it? What are your worldviews? What do you bring to the table? What are you taking away from the table? What are you? I kind of feel like we need to focus in a bit harder on positionality, because if people fundamentally don't change, you can change the organisational structure and partnerships and all of those kind of things. But if the people inside the organisation are still fundamentally promoting stigma or promoting not delivering the best quality service because of who they are and where they come from and their judgments or whatever they bring, then it's not going to promote greater uptake of service.
I totally agree. And see, some at the audits, when we're going in the audits, kind of like always made sure there was a manager, there's frontline staff, and as many staff as possible. But yeah, as you said, the organisation can make changes, but you know, usually the guys that will come into the audits and the workshops and the ones that are championing this work up, they're only a part of that organisation. I agree on all your there's more work to be done.
Yeah, it's the ones that don't show up to the audit.
Yeah,
probably more the worry. Yeah.
Yeah, I remember thinking about this a bit when we were doing this project, and I remember thinking it's that sort of individual versus organisational level change. It's a bit like I remember thinking about it like being on a normal distribution. So the individuals within an organisation, some will be terrible, some will be great, and most of them will be somewhere in the middle. That's what you'd expect. So you kind of, the point of the organisational level change is to try to shift the whole curve to the right. You're still going to have the people who aren't very good, engaging with Aboriginal clients for whatever reason. You're not going to change that, or it's very hard to change that distribution, but you want the whole organisation to get better. Yeah, and that's the best I come up with.
They might be more kind to reduced where they're organisational change.
Yeah, I think it's trying to reflect how you do wrestle with that sort of difference between the organisational level and the individuals within the organisation.
Yeah. And actually, just to finish that point, I actually think that it's the potency of the interventions that I think are really important. And so the organisation, the individual and the client has to be brought together. And then you've got to, and you have to think about the potency. It's one thing to have artwork on, well, we used to have artwork on our wall, but one thing to have artwork on the wall, but it's really, what does that really translate to? And it's about the potency of these types of interventions and the combination really to make it work. Yeah.
totally agree.
Yeah.
That's a little bit about the capable staff is the themes about too, is because you got your worker and your client, and then when we don't know what goes on behind closed doors with their work with clients, you know what I mean? And it's that, yeah. How do we do it, James?
I don't know, Rachel. I'm working in another area now.
Oh.
Yeah, thanks, Rachel and Sarah. I was just wondering in the step wage design that was used for the study, I'm aware that most of the step wage designs that were implemented during COVID were really impacted by lockdowns, especially considering the stepped approach in which interventions are sort of rolled out. So I was just wondering whether the impact of COVID was sort of consistent across all the clusters. There are 6 clusters, which means the period in which you sort of start your implementation or intervention differs based on, the time in which those interventions have been planned for each of the clusters. Sort of wondering if maybe the interruption, whether there is or not, was consistent across all the clusters, and if probably it's 1 or 2 clusters in which there may be a delay in implementing the intervention at the time in which it was pre-specified, probably due to COVID lockdown or whatever, whether that is sort of considered in the analysis.
Yeah, that's a really nice question. I hadn't thought about looking at that specifically. I'm just having a ponder on my feet. I think looking back at the timelines, so hopefully you can see my screen. So I think because we had the opportunity to do the audit 1 the implementation support and audit 2, that all wrapped up about January, February 2020. So I think from memory, COVID was around March, April when things really shut down. So I think the bulk of the implementation was done before COVID hit. It was more that the changes between audit 2 and audit 3, where we had those kind of rolling lockdowns and things in New South Wales, that we would have expected to see changes or impact from that. And we also had, I remember we had the fires. That was really disruptive in New South Wales. I remember Rachel trying to get out to sites to do audits and just like couldn't get to places for months on end. And then the floods happened and it was the same. So we ended up shifting some of the audits online. And so that might have had an impact as well, that difference between face-to-face and digital audits. Yeah, all good points. We haven't looked at it is the short answer. I've just rambled, but we haven't looked at that impact yet. But I think basically most of the services had received most of the implementation before those disruptions happened. So I think that probably covers most of that. Is that fair?
Yeah.
You also have mice. The mice. Remember the mice?
The mice.
The mice.
Yeah.
Don't forget the mice.
Yeah, that's right.
After the floods.
Yeah, that's right. Yeah, the mice.
One other question. Yeah.
Yeah, sorry, go on.
Yeah, one other question. The AIHW report last week about Australia's health, and the Indigenous section shows 35% of the gap is created by social determinants of health. 35% of the gap is created by personal behaviours, and the other 30% is created by access, racism, intergenerational trauma, most likely. But social determinants, still to get people into the service, is going to play a big factor. And you've had a very good impact with your intervention, with your audit results, but no marked difference in attendance or completeness of episodes of care. And so I kind of feel like the other stuff that's before the service, getting people into the service, is also a major factor about this. Once they get there, it seems like it hasn't made an impact. So I don't know. I think it must be about potency or whatever else is missing, and whether it's the challenging staff within the place about being much more culturally competent rather than, I don't know, or the prems and the proms may be really useful to add to this piece of work, I think, so you can understand what's happening for the patients.
Yeah, that was one thing I when we first started, having our conversations, one thing I don't know, we couldn't measure it, was like, if a First Nation person goes to one of these services, do they stay? And we didn't get the data we couldn't get the data for that. Sarah, was that correct? Yeah, because
we had episodes of care, but we didn't have that. I think you're talking about that sort of, if they come into the waiting room, do they have an appointment? We didn't have that data, no.
All right, I just wanted to give people online an opportunity to ask a question. Is anyone online? You have to unmute yourself and speak up because I can't see everybody.
One last question, Rachel. When are you coming to Poche to do your PhD?
Oh, next year? No.
I've known Rachel since when? Maybe
when I first started working in AOD, I met you at this big, I went to my country bumpkin going to the city at this big fancy Aboriginal First Nations health conference, and I met James Ward, and I've become a friend ever since.
Was it around 2003? Was it?
Yeah. Oh, no. I started in 2005. Yeah.
So it's very nice to see your work, Rachel, and really great
James.
work. And thanks for presenting today. It's really good to see. Yeah. And so when you're ready to do your PhD, we'll be here for you. Yeah. Sorry, Sarah, but yeah, it's a claim. Yeah. I put a stake in the ground there. Yeah.
That's fair. That's fair.
All right, we might leave it there. It seems like sorry. Yeah, Kiara.
Sorry, awesome presentation. I just thought I'd comment when James and Anthony were talking about discrepancy between individual staff members versus overall organisational change. If you're not familiar, the literature on norms might be super interesting, specifically injunctive versus descriptive norms. So injunctive are like those top-down organisational level norms, and descriptives are kind of what people see their peers doing. So they're like more bottom up. And some of the literature in that area does show that when there are injunctive norms, but they don't get matched by descriptive norms, people who don't endorse those kind of organizational norms sometimes even kind of reflexively become worse, as like they're annoyed by this order and they become like they resist it. So it might be a literature that's of interest to kind of interpret some of those results.
Okay, thank you for that. Yeah.
Yeah, that's really
Yeah.
nice. Yeah, and I think I'm just reflecting on that comment from James as well. Like, I think one of the things we were trying desperately not to do in this project was to create sort of like a tick box exercise where services could be seen to be behaving really well through doing a bunch of quite tokenistic things. And that's really why we did the project, actually, was to get it, because what was going to happen was the PHNs wanted a guideline. And what we wanted to do was actually take it to this next step and go, okay, so how can we actually work with services to support them in a more meaningful way? It's not perfect, but hopefully it's better than just a guideline that then sat on the shelf and nothing happened. The idea was that we were trying to actually partner with these services and talk them through some things that they could do that would lead to change beyond just having this document that we had some kind of opening for and then nobody ever read. So hopefully it's something in the middle there, but completely appreciate those comments and think there's a lot of work to be done in this space still.
And actually, yeah, I had to answer to some of our art show services as well when we were doing this project, and they had concerns that we were developing this project, and if we're making mainstream services work better with First Nations people, you know, because it's competitive funding round. Yeah, so I was pulled in and I had to answer that, and that was never my intention, because I that's where I started my career in art show, and I know how important our art shows are in our community. So yeah, that was another point I wanted to raise, but yeah.
Yeah, it does sort of flag again, it's kind of like the unfairness on Indigenous people working in this space, isn't it, Rach? That you not only, you know, it's kind of like everyone expects you to do the work to fix things that you're doing, but then, you know, trying to kind of negotiate between mainstream and Indigenous services. So it's just really hard in a way that us non-Indigenous people don't really have to grapple with.
Yeah.
Yeah.
Thanks.
All right. Well, thank you very much for taking the time to present to us this morning. Hopefully everyone found it interesting and challenging. And you know, I'm going to be biased when I say this, but you know, your willingness to try to, you know, actually create change, not just describe problems, but to get in and try to start the process of, you know, how do we actually get services to do something different, not just to wring their hands about how difficult it is. You know, I think is really admirable, and, you know, as is the way for research, it's not the first project is never going to fix it. It's, you know, hopefully this is the first block that we can build on now, and in, you know, 10 years' time, we'll be looking back and be much more advanced in how we achieve these changes. So thank you very much for sharing that with us. And
thank you. Okay. Thanks, everyone. See ya.
Thanks a lot. See you later.
Bye.
Thanks, yeah.